Welcome back to sports. Student athletes' mental health is a serious issue that parents, coaches, fans, and even the athletes themselves often push aside to focus more on their physical training. I spoke with a licensed clinical social worker to learn more about how mental health affects student athletes. For a student athlete, their sport consumes their entire life, but all of the touchdowns and glory can come crashing down when an unexpected injury occurs, causing the athlete's mental health to diminish.
The injury is a loss. They'll go through the grief process, and that it's important for their parents to understand this and not minimize it. It is huge for that student. It is important for them to understand that and to be part of the healing process.
Nancy Marcello has been a licensed clinical social worker for 27 years and continues to help student athletes understand and recognize the signs and symptoms.
Anxiety and depression. Those are two that just the big ones, and it's because of fear. Fear leads us all into huge amounts of anxiety, isolation, and depression. Interruption of their sleeping habits, loss of interest in any activities, loss of interest in school, and even loss of interest in hygiene, taking up substances to improve or to attempt to improve that feeling or to help the brain. If symptoms last more than 2 weeks, it's important to seek help other than just the family unit.
Mental health struggles do not always occur after an injury, but sometimes from the significant amount of pressure put on the athlete by their parents, coaches, peers, and themselves.
You don't want to disappoint anyone, and that puts a lot of pressure on your athlete. Puts a lot of pressure on even your little leaguer that their parents and their grandparents are watching. That's pressure. And it's important to understand it. It's important to talk about it. It's important to do some things that can alleviate some of that stress and improve the enjoyment of the sport and improve their performance as well.
Just like teams practice the physical side of the game, it is important for parents and coaches to stress the mental aspect.
Buy-in. And how do you get buy-in? We take 15 to 20 minutes. We take 30 minutes a day instead of at our discipline, working on the mental side. Prioritize it. Say it's important to me. Say it's important for the team. And put your money where your mouth is. And so instead of having 20 more minutes on the field or court, you're having 20 minutes in a classroom or in a dugout and practicing mindfulness. Stick to a routine. Research things about mindfulness, yoga, practicing imagery. All of those things will help them get through this and become better as a result. Continue to ask questions to their child about what they're thinking, about their mind, about where they are, and to make it okay for them not to be okay. It's okay for you to tell me, hey, we need to get some help, or let's look things up, let's read things, let's figure out things. You're not weak. It is not something wrong with you. We pay coaches to teach us how to hit a forehand or to swing a bat. It's not any different to pay someone to help us or to research to help ourselves mentally prepare.
Recently, more professional and college athletes are sharing their stories about their own mental health struggles, giving younger generations the courage and ability to speak up.
I try to keep my mindset a day at a time. I think that's the best way that you can handle situations like these. This has definitely been one of the most challenging parts of my life for the last several months, but we're getting through it and continuing to improve, mentally and physically every day.
Athletes of all ages can benefit from prioritizing and taking care of their mental health, aiding them to improving their happiness and performance on the field. If you or someone you know is currently struggling or in the middle of a mental health crisis, reach out to the Suicide Prevention Lifeline by dialing 988. Reporting in Alexandria for your local station, I'm Julia Keller.